Patricia, just helping a little bit with your breathing.
COVID patients are presenting unprecedented challenges in hospitals, and this is how staff at Monash Health are preparing.
You're doing really well.
Teams are practising intubations on mannequins to prepare them for the real patients they're doing this to every day.
And out all the way. Great. Yep.
You can probably imagine the extra layers of fear that a patient will have during this time when we're taking over the airway and their breathing for them.
It's these sickest COVID patients who end up in intensive care units. Now, questions are being asked about the way they're being counted in the government's official data.
We have reported, as per the Commonwealth requirements, on the number of infectious COVID patients.
But that's not the whole story. Today there are 110 infectious patients in Victorian ICUs, so that's the number that gets reported. But there are an extra 64 COVID patients who are no longer infectious, so in total there are 174 COVID patients in ICU.
50 or 60 or 70 patients that are in hospital with non-infectious COVID-19 anymore is a significant number of patients.
Why is the government not being clean with what the true numbers are?
We can certainly have a look at the potential to report both numbers.
Other numbers show a system already under strain. Data from June to September this year shows there was 500,735 patients admitted to hospital. That's an increase of 71,949 on the same time last year.
The system isn't pleased with where it's at, but it's very pleased with the way it's performing despite all of those things that are being thrown at it.
And with an increasing number of Victorians enjoying newfound freedoms, COVID cases are expected to go up.
And as a consequence, we need to understand that something is going to happen. It may not be catastrophic, but today the public hospitals are full.
To prevent scenes like these, with ambulances queuing at emergency departments, the government has announced $307 million for hospital in the home programs, extra support staff and more student paramedics. One part of the health system that's really under pressure is Ambulance Victoria. They're receiving about 2,000 emergency calls every day, and that's up about 17% on the previous 3 months. But authorities are confident the system will hold.
It's not easy. I don't underestimate that whatsoever. But we do have systems in place.
Margaret Paul, ABC News, Melbourne.